long-term care facilities. We've done things very early on strict rules, strict limitations on access to these facilities where some of our vulnerable residents are. We've required all people who work with residents to wear PPE like N95 masks, and we want to have those workers to be able to have the ability to get tested as well. So if you work at a hospital, obviously you qualify, but if you work at a nursing home or a long-term care facility, you qualify as well. So we have now, as I mentioned, tested about 163,000 with test results. We've tested more, and those results come in on a rolling basis. We have a total of 6 drive-through sites in addition to the one here in Jacksonville in partnership with the Florida National Guard. So we've had tens of thousands of people be able to come through these sites. We're also doing our best to expand access to rapid tests. These will be a game changer. There's a couple different tests. There's a 45-minute test by a company called Cepheid, and that has been distributed to certain hospitals throughout the state of Florida. And then we have the Abbott Labs 5-minute test that has just come on the market. We were able to get that sent to a lot of hospitals. Here in Jacksonville, they sent it to St. Vincent's, but we're looking to get that available to all hospitals throughout the state of Florida. So some of that is some of the ones that the state has acquired at the Department of Health. We're going to be sending those to different places throughout the state of Florida, but we're also asking some of the hospitals that have a lot of these machines, if you have another hospital system in your demographic, in your DMA, maybe send them a couple so that everyone has access to this, because this really helps healthcare workers. It really helps identify patients as they come in with symptoms, whether they're positive for COVID-19 or not. We're also trying to acquire the new antibody test. There's a lot of these tests out there, but it's important. You got to get the test that's FDA approved for this particular coronavirus. This isn't the only coronavirus that circulates. So some of these tests will determine whether you have antibodies for any coronavirus. Well, if you had a common cold or something, that's much different than this. So we're looking at tests that are FDA approved specifically for COVID-19 antibodies, and then be able to do that. That will be helpful in a couple of ways. One, it'll give us a sense of how much this virus has actually penetrated the community. You have people that are studying this at places like Oxford and Stanford, and a lot of people think that this may have been way more prevalent than we thought. It just, a lot of people don't develop symptoms from it. So that having an antibody test and doing some sampling will give us an idea of how much it's penetrated. It will also give us a more accurate denominator. You know, we test people, and then if they're positive, we say that's a case, but there are probably a lot of people who've never even sought medical care who may have had this virus because they just didn't develop severe symptoms, or maybe they didn't develop symptoms at all. So that's very important. It's also important if you know that you have the antibodies. I think the general thought is that you've developed some sort of immunity to being infected in the future. They're not 100% sure on that, but I think that's kind of the general consensus on that. So I think having wide antibody testing will be something that's very, very important in Florida, and we're working as hard as we can to roll that out. Another update on travel. As you know, when people come to Florida from the hot spots, either by plane or by car, they are being met at the border, met at the airport, and they have to self-isolate for 14 days. So we have screened about 17,000 people from either New York City or New Orleans over the last, I guess we're probably looking at a week and a half now. So we want to continue doing that. We also have put out huge amounts of supplies. As of yesterday, the Division of Emergency Management has sent out 5.2 million masks, more than 500,000 face shields, 4.75 million gloves, and 275,000 gowns. So this has probably been the biggest logistical operation in the history of the state of Florida. I was talking to the White House. We're anticipating getting more of the N95 masks as well. So we'll push even more masks out, hopefully, over a very short period of time. The PPE is very important for the healthcare workers, and it's been a big priority for us here in the state of Florida. If you look at hospitalizations, the whole premise of flattening the curve was you needed the healthcare system to be able to cope with the infections and people that needed to be hospitalized. So that's something that we've taken very seriously in Florida, both in terms of the social distancing, but also doing things like stopping the elective surgeries to make sure we have room in the hospitals. Right now, the capacity in Florida hospitals statewide, 44% of the hospital beds in the state of Florida are available. Statewide, almost 40% of ICU beds are available. Here in Duval County, you got about 45% of the beds are available, and almost 48% of the ICU beds are available. And so we track the hospitalizations very closely to see what trends are developing. Over the last 8 hours, there's been a net reduction in 50 people hospitalized for COVID-19, a net reduction of 2 in Duval County, but that is really a good indication of how this is trending, so we keep an eye on that. We also, though, even though there is capacity, we've planned from the beginning if there were to be a surge situation. So we have facilities in Miami-Dade, Broward, Palm Beach. We have the capacity to have a field hospital here in Jacksonville should the need arise. And then we're also looking at Central Florida and trying to figure out how this develops. But right now there's capacity, so that's a good sign. And we want to hopefully get through this where the hospitals are intact and we don't have any part overflowing. One thing that we've been very insistent on really from the very beginning is protecting nursing homes, long-term care facilities, and assisted living facilities. This is a virus that, if you look in the state of Florida, over 85% of the fatalities are people 65 and up. Usually they have chronic conditions, but clearly this is a virus that I think presents a specific danger to elderly populations. And so we've done things like put strong regulations in place, limit visitation, and require that hospital staff wear personal protective equipment, including masks when they're interacting with the residents. And I think by and large in the state of Florida, the folks who've been in charge of these facilities have worked very hard at protecting their residents. We have had the Department of Health now has a strike team on site at a nursing home in Suwannee County. There was an outbreak there emanating from staff members. So we have 51 people affiliated with this facility that have tested positive. 30 of those are members of the staff. And so this is a situation where, if a staff member is sick, they cannot be allowed to go into that facility. And it seems like most of the interaction was with other staff, but you still have 20 residents that have tested positive. There are more that are waiting results. So that investigation is ongoing by the Department of Health, but they have traced the positive cases back to an employee that is working directly with the residents. Final update I have is regarding the unemployment compensation. So far this week, we have a total of 225,755 initial claims that have been filed. Obviously, those need to be processed. We have the Connect system, where there were some changes to that to increase capacity, but we've also done a PEGA site, so people can apply through that, and then the data is going to need to be migrated through Connect. So they're working on that, but that site is able to take a much higher volume of people coming into the site. We've also have almost 12,000 applications received by paper. Federal Express was kind enough to offer their stores where people could drop off applications, and then they're now mailing them to Tallahassee. We have over 2,000 state employees from various agencies that are either on standby to help this or are actively helping the processing of these applications. We've also beefed up the call center, and I've told them you need to beef it up as much as you can to be able to meet the demand. You're seeing this throughout the country, but the amount of unemployment claims nationwide in just a few-week period, I think it took us a year or certainly many months to be able to reach this level of claims during the Great Recession. So this is a shock like we've never seen before. So we're shifting as many resources to this as we can to be able to meet this real crushing demand. So I want to thank the mayor, the sheriff, Jacksonville Fire Rescue, everybody who's been involved in this site. I think it's important that we keep it going, and I think it's important that we're going to have expanded test criteria so a greater variety of people can come in, anyone with corona symptoms, anybody who's works at a healthcare facility or is a first responder, and then even if you haven't developed symptoms, but you've had close sustained contact with somebody who has recently tested positive, and you want to come and get tested, we are testing those people as well. And I think that that's a good approach, and I think this continues our efforts to make testing widespread in the state of Florida. With that, we're going to hear from the mayor and then hear from Director Moskowitz.
Thank you, Governor. Just like to say to our Jewish brothers and sisters that are celebrating Passover, and those of us that are Christians remembering Good Friday and looking forward to the resurrection on Sunday. It's a reminder that we all care about each other, we all count on each other, and we're going to come out of this and look forward to a new day because we're all doing the right things. I want to thank Governor DeSantis for not only keeping this testing site going, but for all of the communication, all of the access, and all of the help. He and his team have been so accessible and so helpful over the last however many weeks this thing has gone on. When I learned that this testing site was going to potentially close down, obviously it was a credible concern as we're in the middle of this, as we appear to be flattening this here in Duval County. The governor called me 2 nights ago and said, if you want to keep this going, we're in. So Governor, to you and your team, thank you very much. I want to thank the governor and Director Moskowitz for the $20 million that you expedited from other crisis dollars that we had spent. That has allowed us to deploy that cash to make sure that we can respond to this appropriately and accordingly. Would remind people the criteria for testing here: respiratory symptoms, or a first responder or a healthcare worker that's had contact with patients, you can be tested for COVID-19 at this location. And then also a thank you to the National Guard. My understanding, they're here now, but Monday they'll begin running shifts, which will allow our first responders, Jacksonville Fire and Rescue, and police officers, some of those, to get back to some of the stuff they do in terms of caring for people in our community outside of this site every day. So again, thank you, and Director Moskowitz, I'll turn it over to you.
Governor, thank you. Mayor, appreciate all your efforts. I also appreciate you lending us your mobile command unit so that we can have that at our EOC, so that we can decompress some of our EOC, so that we also could follow social distancing guidelines at the state EOC. So thank you for that. As the governor alluded, that we are running the largest logistics mission in state history, 24 hours a day out of our work.
All right, you've been listening to a press conference from Governor Ron DeSantis from Duval County, coming from Jacksonville, actually, where the Jacksonville Jaguars play. A stadium there held for football, but has been turned to a testing site for COVID-19. Just a few moments ago, you heard Jacksonville Mayor Curry saying that he was grateful to the governor and to the state for keeping that drive-through test site open. And that's because the government, the federal government, had been funding the testing in Jacksonville and Orange County and right here in our own backyard in Miami Gardens at Hard Rock Stadium. But that funding was set to end today on the 10th of April. The state then stepping in and continuing that testing, funding the testing of COVID-19 moving forward. So what does that mean, the fact now that the state takes it over? Well, Governor DeSantis saying that now the eligibility changes here, whereas there was an eligibility requirement for people who were going to be tested. That number now goes up. So now you no longer have to be a certain age. You no longer have to be exhibiting symptoms. If you feel like you need to be tested, you can go ahead and come to Hard Rock Stadium. There's a lot of information we are breaking down for you this midday and throughout the day here on NBC6. So stay with us on all of our digital platforms, the NBC6 app and NBC6.com. We're right back here for you throughout the day, and then, of course, on the NBC6 News starting at 4 o'clock.
If I don't have insurance. So there's so many different little issues and ingredients in this whole situation. It's like a perfect storm, what we're seeing here in the worst way.